Hello everyone, Happy New Year. What a great time to start our conversations and making plans, therapeutic plans for New Year. I love to review what's new. We love to bring new tools, new devices, and think about comprehensively what we can offer to patients beyond the treatments that we used to do. So I am delighted that Otto, that I've worked with for years, has brought a new tool for me to work with. I've worked with injectables for many, many years and loved them. But for many patients, it goes beyond injectables or energy-based devices. We have been excited about adding threads to our treatment plans. So Otto, Happy New Year to you.
Happy New Year,
Dr.
Dr.
Being
Prey.
here with me.
Thanks for having me.
I'd love to chat about this new tool that we have because it really has been terrific, and I've worked with this now for several months with great results. The Miracu threads have been around for quite a while, haven't they?
Yes, the inventor, believe it or not, threads are similar materials. Have a little show and tell here.
Perfect.
And I think all of us as kids, I don't know, some maybe have had stitches before. Well,
Right.
You use that material, suture material. That's what a lot of these threads are made out of. And you've been doing threads for quite some time. This is just a new brand, and this is the world's leading brand out of South Korea called Miracu. And the reason why physicians like Dr. Prey prefer these is because they have a much higher tensile strength, which means they're going to lift and last longer. So she can tell you about some of the benefits, but pretty much what they're made out of is a dissolvable stitch or suture material called PDO. There's a longer name than just PDO, but you probably can tell everybody that. And it dissolves and builds more collagen.
Right, and that actually brings up the dual benefit, that lifting effect that patients get from the threads that are placed very carefully, mid-face and laterally, and then also collagen production. Otto has mentioned very kindly that I have worked with threads for many years, and I've liked the threads that we've worked with. I've loved the results, but they were a little bit more complicated from a patient's standpoint as far as placement. So one of the things that I've enjoyed, of course, results are the driving force behind anything that we add, but the ease from a patient's standpoint. As you will see, there is just a small entry point when we introduce the thread, and then depending on the patient, whether we put 2, 4 of those threads through the entry point and then retract and the thread stays in place. The threads create a wonderful lift that is obvious almost immediately, but then it continues because of the collagen production stimulation and hence over the several months. Otto, tell us a little bit more about what studies have shown as far as the longevity and the immediate benefits of the threads.
I like to equate this to fillers in terms of duration. I know there's different fillers have different durations, right? Similar to this, you have a couple different boxes here representing some of the different lines. Probably the strongest lifting thread is called their elastin line,
Right.
and that's a Forte, which is a 17 gauge, which that's, you don't have to know all that as a patient. You just want to know that's going to last longer than some of the others. And so that's going to typically be, close to 18 months, we like to tell patients. And then most of the time about a year or so for the lifting type of threads. And what's so nice being here with dermatology consultants are always staying ahead of the forefront of looking at what's the best for their patients. Dr. Prey did the assessment, found that this is, like you said, a much more comfortable option for the patients. They see an immediate result and it continues to enhance over time. These other threads here, this is called their Forte line, and this can be pretty much used on anybody.
Right.
So for the first time.
And I've used both. It really is, of course, always patient dependent. How much lifting, what's the tissue thickness, what are the goals of the patient. We sit down and talk about it and start the whole process with a consultation, and then the treatment follows. And it really is such a great, easy treatment to incorporate into our busy lives. It doesn't necessarily replace the fillers. I mean, I've used it with both, and they complement each other. As I'm hoping that everybody has been looking at our blog for the month, it's all about regenerative medicine, and we are really focused on biostimulation, introducing tools. Some of those Benev also carries, like exosomes. We'll be talking about those. We have talked about this in our blog, but we'll be talking more extensively during a different coffee chat. But it's all about biostimulation. It's all about collagen production. It's all about regeneration. And these cool, tiny little threads, the monos, do exactly that, don't they?
They're great for smile lines. They're all those little areas that sometimes you think you could put filler, but you're gonna prefer doing a thread. And they're super comfortable compared to a lot of other procedures and quick, which is
Talk
nice.
about easy. I mean, this is really, we do use a little bit of injected anesthetic for the other threads. This is almost done without anesthesia. Sometimes a little bit of a topical anesthetic and beautiful immediate results. I've loved those as well.
If I could point out, I think that's a good point. A lot of times, of course, being on social media all the time, that's why we're talking right now, people go and they'll look at something. And I know a lot of times when you see threads online, it looks more, I guess, intense than it is. I say it's like going to the dentist, you know, do a little bit of numbing and then you just feel a little bit of pressure, but not much. So I say come in, get a consult from Dr. Prey, let them really show you before and after pictures and explain more to you rather than just looking around online about it.
And I think that's a great point because, you know, I do talk to patients. Everybody knows that I love talking to patients about what we do. And these have been comments, a little bit of concern, gosh, it looks a little scary. I'm worried that it will hurt. And it really is more pressure. There is really no significant discomfort. And, you know, we do have lots of our own wonderful employees that have been treated. So there are people on site, so to speak, that you can ask about their experience as well. So the bottom line with this great new tool that we've added is that it's very easy on a patient with very little recovery, with a very natural looking result, that natural lifting effect that happens immediately and then improves and really enhances over about 2 weeks or so, and then lasts, depending on the choice of the thread, anywhere from a year to 18 months. These mono little ones that we use for smile lines may have to be replaced a little bit more frequently, but really great results. We do this together with fillers, we do it together with toxins, we do it together with our energy-based devices. So keep in mind, really starting the year refreshed, and regeneration is the name of the game. I do not want to forget to talk about this, not just on the face, because we are very body focused. So before we say goodbye, Ara, let's talk a little bit how these have been used above the knees,
Sure.
elbows, and so forth.
I think similar to some of the other things that you offer in your practice, we have skin all over our body, right? And so gravity continues to do its thing. So wherever you think you have some lax skin, it could be knees, it could be tummy, you can actually use threads to help lift those areas as well. So that's impressive with this because you're not just limited to the neck and the face.
And again, we combine it with our energy-based devices that we have in our body center, and that works really well with microneedling RF, you know, one of our favorite Silpherm is beautifully coupled with that. We're using MRI energy. So there are a lot of tools that can be coupled with this approach. I have been very happy. I am so glad that once again you come through and bring great new tools to my attention, and I can't wait to meet everyone for a consult. Our providers, Dr. Juno, Dr. Iyer, Dr. Arnold, are performing these treatments, so we do have these available at all of our offices, so come and see us. Thank you for your attention this morning.